Hey guys, can you hear me?
Yes.
Yes. I know who that must be. Sorry, I'm having a little bit of computer issues, so no. So sorry. Can you hear me?
Yes.
Okay. Sorry about that. I had to, long story short, my keyboard was urinated on again by my dog, so I've been having to kind of ghetto rig everything so that I can use my laptop. So sorry that you can't see my face today, and thank you for being on time. Looks like there's 4. I know that one person's not going to be here. We have 6 in the class, so what's 6 minus 1? You guys.
5.
Yeah, I'm like, hello, really? Maybe we need to work on some math. Okay, perfect. Okay. So I'm going to just get started with basic, just very short housekeeping stuff, as I had mentioned that I like to do. Number 1, if you will notice, I am recording. I hope that's okay with everybody. I'm going to try Maite. Is that correct?
Yes.
Yeah, it's nice to see your beautiful face. I don't know where everyone went, but what is happening with my computer? Mind of its own. I'm going to be sharing the screen in a minute anyway, but can you guys see me or just hear me?
Just hear you.
Okay. What do you see on the screen?
Like join audio, share screen, invite others.
Okay. Let's just get started then as I'm talking. So I did have a really nice conversations with all of you in regards to, or I think I got all 6 of you, right? Everybody that's on there, we had a conversation?
Yes.
Okay.
Yeah.
I had to mark down that we did, so perfect. Okay, so, and it seemed like everybody was really on the same page as far as what they were interested in learning about, and kind of, like I had mentioned earlier, basically creating the class to you instead of taking a class and just doing what may not be as beneficial. So I felt really good about that. I hope you felt really good about that. Today, it being day 1 of that, it says we have 4 participants. I can't see who's on. So, Caleb, who are we missing? Is Alice on?
I think we're missing Elise, Leslie, and
Guadalupe.
Guadalupe. Yeah.
Now I remember. Elise. Oh my God, is it Elise? Oh, I've been calling her Alice. Sorry. Oh my God.
It's Elise.
Okay. She's a clinical. Lupita, we already talked. So that's one reason why I'm recording it, because I want to make sure that everybody gets everything that happens, because like I said, sometimes there's going to be some pretty, in my mind, monumental things that are really, really important. Most of what we do. And I really don't want you to miss that opportunity. So I will be uploading the video usually within 36 hours, and then it's up, and you can take a look at it. So what we're going to do is we're going to review the 5 practice NCLEX questions so that we can practice. That was one thing, and I will give some strategies and kind of some tips and hints here and there. This isn't going to be the biggest, oh my God, one. I don't want to do this whole big, overwhelming, introduction to it, if you will. And then after this, we'll probably be done in 35 minutes or so. Then I just have 2 very short after assignments, which is basically the first one has to do with just to reinforce that I know that this was something. We have to, well, not we, I feel it's important to evaluate that you actually did learn something, and that's important to me. So I think the first question is, can you please name a couple tips and strategies you learn, name like 3. And then the other thing was, why is it important, or something basic, but will help me evaluate that you did get something from it. And I believe I picked all psychiatric questions on purpose because you guys have mental health coming up. So can you guys all see the questions that are up here?
Yes.
Okay, perfect. Okay, so I have not graded them yet. Did I grade them? No, I did. Everyone got, obviously I'm gonna not take off points, that would be mean. So what I'm gonna do, I hate not seeing you. I'm so sorry that I'm getting a new computer very soon. This just happened about 2 days ago, so I apologize. I usually always show my face. I think it actually is a better learning tool when you can see my expression and all of that, so I do apologize. But you can be mad at my pug, who is a jerk. So, but we love him anyway. So let's go ahead and get started. Before we start with the questions and go through them together, did anyone have anything that they wanted to add, or any questions about the class, or since we've had time, to think since we've all had our conversations, or anything before we go down the 5 questions? No? I can't see you, so I'm just, okay. All right. Well, since no one said anything, and feel free, as we're going through the questions, feel free to talk, ask questions, or give your input. I may say, oh, this is how I got to the answer because of this. And if you have an idea of how you did it, please share with us. I mean, my strategy is not the only strategy, right? This is definitely something where we can help each other. Okay, so these are actual NCLEX questions that I got from Kaplan, where I teach. So these questions, I'm not saying these can be exactly found on the NCLEX. However, these are very close to NCLEX type questions. And again, I chose all pretty much psychiatric questions. Just confirming, we did not go over this, right?
No.
Okay.
No.
I just wanted to make 100% sure, because I'm like, why do I feel like I'm doing the same thing again? That was the first semester. Okay. All right, so let's go ahead and get started by, if you're taking notes, I would like you to write down just a couple things. And I'll do this every time that we do NCLEX questions. The first tip I want you to think about, please, is when you're reading the question, the main point of reading the question is, of course, to figure out what are they looking for, right? What is the question actually asking me? And many of us, including myself, still to this day, I have to watch myself, because I will make up a story. Number one, I will make this say something completely different and then get the answer wrong. We don't want to do that. I know we always say it as instructors, but really try to hone in on that. And that's why I do things the way I do. And hopefully you'll notice that as we continue doing questions. So another thing that I really want you to look at is if they give any type of age. So if they gave the age of, is it a 2-year-old? Is it a 12-year-old? Is it a 50-year-old, 75-year-old? Age could be important, not always, but I would take note of that. Another very, very important thing to take note of is time. So for example, in the first question, they're asking something and it says 2 hours after. So is it immediately after the procedure, 2 hours, which I would consider that fairly immediate? That's freshly done biopsy. Was it a week ago? Madison, shh. Time is of the importance as well. So those are just a couple things to get started with. And then the last little tip I'll give before we actually get into the questions is that a lot of the time, if it's a priority question, like what would you do first, or what is best, not all the time, but some of the time, I'm trying to find one on here, if it's here, like the one about the hotline crisis, number 1, 2, 3, and 4, for the individual calls a hotline crisis, you would do all of those things. But what is the most important thing to do first? So remembering, what would you do first? Even though you're going to do all of them, what would you do first? What is the most important? And when we get to that one, and I did look, and I don't know, most of you did not get that one right. That I think is the hardest one. Okay, here we go. So the nurse cares for and I still didn't fix the typo. The nurse cares for a patient 2 hours after a percutaneous liver biopsy. So it's percutaneous. I know they're going through the skin. If you did not know this, the liver is very vascular. That might be something important. Hey, you just learned something new if you didn't know that. It is very vascular, meaning that it would potentially do what? If it was poked at or cut on, it may have the potential to do more of what? If it's vascular.
Bleeding.
Yeah, exactly. More potentially more of bleeding. So that's something that's important to know that you may not have known. Is that going to make you pass your NCLEX? I'm not saying that necessarily, but hey, we're on here. Might as well learn as much as we possibly can. So, and you could totally answer this question without knowing that. I just figure, hey, if I can teach you, let me just teach you. Perfect. So yes, you're absolutely right. So we're doing a percutaneous liver biopsy, and how they do a percutaneous liver biopsy is they take a big long needle with a big lumen at the end of it, and basically stick it into the abdominal area where your liver is, which is the upper right-hand quadrant. And they're taking cells from your liver to be able to see what's going on, potentially cancer or cirrhosis of the liver or what have you. Okay, so we have this patient 2 hours after this procedure was done. What finding requires an immediate intervention by the nurse? Now, this is important. It's asking me, what is it asking me? It wants me to know what requires immediate intervention. What am I going to do first? Okay, all right. So I'm going to start reading it. Number 1, the client is positioned slightly on the right side with a pillow under the head. I'm not going to answer anything at this point. I'm just going to read all of them. But I'm looking at it and I'm like, okay, all right. Doesn't sound like horrific, but look, what else do we have? Who knows, right? Number 2, the client reports aching, throbbing pain that goes up to my shoulder area. I can tell you right now, they are trying to trick you. And I will tell you why when we're done, but that is not the correct answer. Many people pick that answer. I don't even remember from you guys, but most people pick that answer, and because the NCLEX is mean and they're trying to trick you, and I will tell you why it's not. And then number 3, the client states, I do not want to take the stool softener ordered for tonight. Well, again, I'm not going to answer anything at this point, but I'm not sure if that requires an immediate intervention. I really hope there's something more important on here. And then number 4, the client states, my stomach feels tight and reports increased abdominal pain. Now, does anybody want to go ahead this I know, sounds silly, it's a safe place, but does anybody want to take a stab at it and tell us what they got?
I'll go.
Go ahead.
Oh, wait. You want to go? It's okay.
No, go ahead.
All right. I put D, the client states my stomach feels tight and reports increasing abdominal pain because compared to the other problems, like this one was more, like it seemed more towards like the liver.
Yeah.
My stomach feels tight and then it's like increasing abdominal pain. And it just came out of surgery.
Exactly. Surgery, procedure. They just came out of something where something was done that was put into the body that could potentially cause a problem. So Caleb is absolutely correct. Number 4 is the answer. And I'm going to, and he actually explained it how I explain it. But I'll give you a little bit more information as far as what I like to do is kind of, how would you say? I compare the answer. So for example, if I'm looking at number 4, I would say, let's say I'm just doing it backwards. The client states my stomach feels tight and reports increased abdominal pain. So I'm looking at 2 things. Number 1, I know what they just had. We don't need to go back over that. It says my stomach feels tight. And Caleb mentioned that's where the procedure was done, was in the liver. and the liver is in the abdominal cavity, right? So if something's feeling tight, what do you think that might potentially mean? What's happening in that cavity? Something's filling it up, whether it's serosanguinous fluid, blood, something's happening. And then it reports increased abdominal pain. See these special words that can potentially make an answer right or wrong? It can take one word. So I like this answer, but I'm gonna now start comparing it to the other ones. Now, what's more important, number 3 or number 4? The stool softener, which is not important because they're probably on pain meds and all that good stuff. And yeah, I want them to take it, but what's most important, number 3 or number 4?
Number 4.
Exactly. So I can eliminate number 3, bye-bye, and it's gone. Number 2, the client reports aching, throbbing pain that goes up to my right shoulder. So what they're trying to do here is do, I think, one of 2 things. So a lot of the time when they do a liver biopsy, they'll put that CO2 when they're doing laparoscopic stuff, and gas is released into the body and tends to go to the shoulder area, and it causes an aching pain. That's one reason they might be trying to trick you. And if you don't know this, writing it down really might help. You never know. There could be a question like this on your test. And another reason is because your gallbladder. So I don't know if you guys remember or it was ever brought up, but your gallbladder, that's actually a very weird, odd sign because it's referred pain. But when your gallbladder is not doing well, there's referred pain to the shoulder. So they're trying to trick you here, basically. So it's the wrong organ. So if you knew, but let's just pretend you didn't even know that. Let's pretend you didn't know that. So let's hold on to it. At this point, we have number 1, 3, and 4. All right, sorry, I apologize. We have number 1, 2, and 4. Because we don't know yet about number 2. We're not quite sure. So now number 1, the client is positioned slightly on the right side with a pillow under the head. This is something we actually want. The liver's on the right side. It says slightly. It's not saying crushing or, that we're doing anything that could potentially cause we're trying to put pressure on the liver. This is what we're doing. We're not, does that make sense, that word? Do you see how it's easy, just that one little tiny word, what that can do? It's amazing. I can't see your faces, so I'm thinking that, or maybe I can. If I press that button. No, I just see me talking. I'm hoping you're looking impressed. I don't know. So number 1, the client is on the right side. We want them on the right side because we're putting that little bit of pressure. So now I know I can easily eliminate number 1 and number 3. Does anybody disagree with that? That 1 or 3 are gone? Okay. I didn't hear anything, so I'm going to keep going. Now let's say we go down to number 2 and number 4, and I don't know, and I'm like, oh my God, I don't know which one. Well, if I had to pick and I didn't know, and it does really come down to, I don't want to say guessing, I like to say educated guessing with information. What Caleb said earlier, okay, my stomach feels tight. We know the liver's vascular. That's where the liver is, and is reporting increased abdominal pain. Now, yes, I care that my patient's having an aching, throbbing pain in the shoulder, but is that probably going to potentially kill the patient? Which one do you think is more important, where the surgery was or procedure was performed in this question, or in different area in the body in this question? Number 4, right?
Yes.
Because I can't see you. Perfect. Any questions? My God. Sorry. Shh. Any questions about how I got to number 4? And that makes complete sense. Okay.
Yes.
Good. Okay. What is a paracentesis? And Caleb cannot answer this one question. Not because I'm mean, just because he can't answer this. What is a paracentesis? And if you don't know, just totally, I'm going to give like 10 more seconds if no one says anything.
isn't it like a procedure where they get a sample from the peritoneal fluid?
Everything was correct. Yeah, I'm going to say yes. I'm going to give that to you. Yes, it is. I like the way you worded that. Very nursey too. Thank you. Very, I love nurse terminology, and because we need to start learning to use it third semester and all that. Excellent. So paracentesis is basically where you're taking fluid from the abdominal cavity. And the reason when I said I'll give it to you is because you are right. They could do that as far as taking a sample. Usually it's done because they're removing a lot of fluid, and that's because your liver is not working properly. And when your liver's not working properly, unfortunately, you do not create enough of a certain protein called albumin. And when you don't create enough albumin, albumin is basically tells your body where to put the fluids. And you have this large cavity, which is your abdominal cavity. So where do you think everything's going to get pushed into? So you can actually have a tiny woman of 90 pounds, like 8 months pregnant, when it's all just fluid. And it's really sad. And it's basically when the liver is starting to fail. It could be for other reasons, but for this is mental health. So that's why this question is being asked. Now, do you need to remember every single thing I just said? No. The main thing I want you to know is what a paracentesis is, and usually it's related to some sort of liver issue. Okay. I don't know who answered that. I think it was
Maite.
Yeah, okay. I thought so. I was like, please. Okay. The LVN is reinforcing teaching for a client who is scheduled for a paracentesis. So they're scheduled. Do they have the procedure? They're scheduled for a paracentesis. Which of the following statements by the client indicates that the teaching has been successful? So are we looking for something right or something wrong?
Something right.
Exactly. And that can be really important because we can get so confused. So this is how I like to usually answer questions so that I stay on track. So I say, number 1, I will be in surgery for less than 1 hour. If my patient said that, is my teaching successful? And I could go longer and longer based off of a paracentesis, whatever. No, I don't need to do that because I know what the question's about. But you see what I mean? I repeat it to make sure that I don't get confused. So number 1, I will be in surgery for less than 1 hour. Does that show that my teaching was successful for my patient having a paracentesis? Number 2, I must void. Void means what?
Urinating.
Good job. I was like, if one of you says pee-pee, I'm signing off. Because that's actually what I was thinking. Because I have to go to the bathroom. Number 2, I must void prior to the procedure. Would this show that my teaching was successful for a paracentesis? Number 3, the physician will remove 2 to 3 liters of fluid. If my patient stated this, would it show that the teaching is successful? Excuse me. And number 4, I will lie on my back and breathe slowly. Does this show that my teaching has been successful? So between 1, 2, 3, and 4, and this is a hard question actually as well. Why is number 1 not right? It's just one word in there that makes it not right. Is there a difference between surgery and procedure? Yes. Is a paracentesis a procedure or a surgery?
Surgery.
Don't know.
Oh no, I mean a procedure. Sorry.
Like I'm whispering and no one can hear. Exactly. It is a procedure. So is number 1 correct?
No.
No.
It's a surgery. So I can just eliminate by number 1. Number 2, I must void or urinate prior to the procedure. Would this show successful teaching for a paracentesis? And this is a difficult question. I'm going to leave this because I'm going to say I don't know yet. I don't know, because for most procedures, what are we taught? Have your patient void first, right? For most, not all. So let's hold on to it. Number 3, the physician will remove 2 to 3 liters of fluid. I'm going to definitely hold on to this one because what is a paracentesis? A removal of fluid, right? But 2 to 3 liters sounds like a lot. And I'm sure most of you are thinking that if you think of a 2-liter soda, how big that is, that's a lot of fluid, right? Then number 4, I will lie on my back and breathe slowly. So, does this show that teaching has been successful? Does anybody want to take a gander at why they picked what they picked and it's not number 2? You actually want, if they do have, it's not a requirement for them to void before the procedure, because it says I must not void prior to the procedure. It doesn't make a difference either way. Does anybody have a question? Or if you don't, sorry, I totally had a blank out. So when it says I must not void prior to the procedure, the only time usually you don't void before the procedure is if you want things to be shifted or moved up, right? Or you're doing a bladder scan, or well, obviously before you do a bladder scan, you usually don't have them, or depending on what the order is. But I must not void. That would be uncomfortable, right? Especially if you're going to have a paracentesis, because we're not taking urine out. And I think that's where they're trying to trick you. They're taking out fluid out of your abdominal cavity, not out of your bladder. It has nothing to do with your bladder. So I must void, oh my God, I keep reading it wrong. I'm sorry. I must not void prior to the procedure. Does that make sense why that's not correct? Or nobody has any, once you hear the right maybe answer to that, that might bring up a question. And then number 3, the physician will remove 2 to 3 liters of fluid. Did anybody put that as their answer? I want to explain why, because it's correct. Rosa. I know it was a year ago. We went over this question.
So wait, you want to know why it's correct?
No, why is number 3 correct?
Mm.
Because that's a paracentesis. Really, that's literally all you have to say. When you're reinforcing teaching about what you're going to be doing during a procedure. So if I said, I'm going to amputate your leg.
Okay.
And I
Makes sense.
cut off your leg, that would be so a paracentesis is removing fluid. Now the important thing that you need to know is how much fluid. They don't remove more than 4 liters of fluid at a time. So that's what I want you to get from this question. So that is what a paracentesis is. The physician is, and it has to be a physician or an MP or a PA, is removing 2 to 3 liters of fluid from the abdominal cavity. That's exactly what it is. So even if all the other ones kind of well, I'm not sure, in black and white, number 3 is right. Did that rhyme? It did. but that's absolutely correct. Okay. This one is going to be, I'm going to make it a little bit of a, first of all, we're not going to do the last one. Well, okay, yes, we are. It's not psych, but we're going to do it. Okay. This one is going to be a very, very basic one, and I'm going to do it on purpose for this reason. So an individual calls a crisis hotline and says, "It's over. I've done all I know how to do." Which response by the nurse is best? Without even looking at the questions, we know it's a therapeutic question. How do we normally answer therapeutic questions? Open-ended or close-ended questions?
Open-ended?
Open-ended, yes. Now, that's not to say that sometimes we have to ask close-ended. I mean, it can't, right? I mean, sometimes we get nowhere. But I think it's important to always remember that usually it is open-ended. And now imagine, really now put yourself in this place. You're working at the hotline, you pick up the phone and someone says, "It's over." You don't know their tone because it's not on the audio. it's a question that I'm reading. I've done all I know how to do. Which response is best? Did anybody pick number 1 and tell me why?
Yes.
Why?
Because it's pretty much an open-ended question. You're looking for more clarification as to what does he mean by it's over.
Exactly. And this is what's so hard, is because we want to ask number 4, which is going to, of course, be the next question. But I have no idea. It's over like my
TV show.
It's so inappropriate. Thank you, Rosa. Like, usually I have like my things already I can pull them out easily, but exactly. I have no idea what you're talking about. Yes, you are calling a crisis hotline, but you could be talking about it's over. I've done all I know how to do. Well, you could be talking about refilling a med. You could be talking about your sister who's not doing well. May have nothing to do with you. I need more clarification on what is going on. So you must get more clarification. Then you can ask, are you thinking of hurting yourself? So you're starting by building that rapport and clarifying. And usually when I teach this question, that's all I say, because it keeps, now I'll probably ask you all of these questions if it's indicated. But do you see why number 1, if you didn't pick number 1, why that clarification is so important? Even though you really want to ask number 4 first, and it seems like, oh, it's psych, it must be right. It's hard to me, I think. And I'm a psych nurse. Psych questions are, in my opinion, are the hardest. This one's fun though. Caleb's going to learn about makeup, the next one. Or more about makeup if he doesn't know about makeup. Any questions on the one about it's over and the clarification? I can't see your faces, so it's really hard to like get a good feeling. By next week I will. Okay, so it does make sense. Please, I mean, this is why you guys are here.
Yes, no, it does.
Okay, I just want to make 100% sure. And everyone's still here?
Yes.
Yes.
I trust it. I'm just trusting. Okay. Did Leslie
No.
come? Okay. Okay. All right. So the next one. The nurse visits a client in the home 2 weeks. Okay. They're giving me a time frame. That might be important. After a total laryngectomy procedure. What is a laryngectomy? What am I removing?
The larynx?
Yep. Very good. So that was 2 weeks ago. It's not too long ago. Probably still having some healing going on. So I hope so, as what the norm is. Which statement by the client concerns the nurse? So am I looking for something right or wrong?
Wrong.
Exactly. And so this is how I'm going to ask it so that I don't get confused. Number 1, I cover my stoma when I am putting on my makeup in the morning. Would this be something that would concern the nurse?
No.
Exactly. What is a stoma? It's an opening, right? And why would that not concern me?
Because she's covering it while she's putting on makeup.
And for Caleb, I don't know what you do know or don't know about makeup, but a lot of makeup has a lot of powder. And so would we want a bunch of like powdery stuff potentially going into that stoma opening in the neck? I want to hear Caleb say it. No.
No.
Exactly. So if you didn't know that, now you know that. So it's kind of cool. So exactly. So number 1, boom, cross that out. Number 2, I clean the area around the stoma with alcohol twice a week. Is this something that could concern the nurse?
Yes.
Yes.
Damn, good job. Yes, because alcohol is very drying, number 1, and twice a week is not enough. And you clean a stoma with, if you don't know this, you can, I almost said wipe it down, write it down with just soap and water. You don't need alcohol. It's very drying. Remember, this is a mucous membrane. It's a hole in your throat. So it's like your mouth, right? Would you want to like clean your mouth with alcohol? I mean, we're recording, so I have to be careful what I say, but for things that aren't fun purposes, no, we wouldn't do that. So we can cross that one out. Number 3, we have started to use a bedside humidifier in the bedroom. Is this something that would concern the nurse? We already know what the answer is number 2, but no, we want humidification. Wait, did I just say that number 2 is not concerning?
Yes.
Oh, it is concerning. Sorry, I heard what I wanted to hear and then explained it correctly. So it is concerning because we don't want them to dry out their stoma. You know, some wounds heal from the inside out or outside in, or depending on what it is. So it is concerning because we don't use alcohol to clean it. We use soap and water, and we would clean it more than twice a week. So that would be concerning. So make sure to make that note. Number 3 is not concerning because humidification is good, right? We want to keep that area, I'm sorry, I know a lot of people don't like this word, moist, because it's a mucous membrane. Is your mouth moist? What's in there? Spit or saliva, sorry, right? For many, many reasons, but we keep that area moist. And when it's not moist, does it not feel good? We want water in there, right? Yes. And then number 4, when I prepare food, I find that it does not always appeal to me. So this is why this one is, it's slightly concerning, but it's not saying I've just lost 10 pounds in 2 days. So a lot of people will pick that one, but then I compare the 2. Which one would be most concerning? It's just saying when I prepare food, I don't always find it appealing. So I have to look at those key words. Number 2 is much more of a concern because that can cause infection if it gets too dry and it's going to get crusty and gross. Any questions how now I either explained it or turned it to make it make sense? People like that one too. They tend to say that they think that one's right. Okay, so hopefully you're learning at least 3 things because that goes on your little list. Okay, then the last one is not. It's med-surg because it's fun. And I just figured I'd throw it in there. So the nurse cares for a client receiving basically nutrition through a CVAD. If you guys are not familiar with, which I'm sure you are, a CVAD is basically it's like an IV that goes to different areas of your body depending on what it's doing. But for this one specifically, I can't say the word, that's why I don't say it. Can someone say it? Parent, I can't say it. Parenteral. I can't. Caleb, say it.
Parental? I don't know. Parenteral?
Parenteral.
He's already going to get picked on. He's the only boy. And that's not sexist. It's just to be funny. So yes. Okay, so which is the most important action for the nurse to take? So let's pretend we don't even know what that is. We don't know what a CVAD is. We don't even know what it is. We can still answer this question. So number 1, remove the old dressing over the insertion site, moving against the direction the catheter is inserted. Number 2, clean the insertion site with an alcohol swab, moving from the outside to the inside in a circular pattern. Automatically, do we know that's wrong? How do you clean anything?
Inside to outside.
Exactly. Dirty to clean. So number 2, out. Number 3, flush the unused catheter lumen with a 10 ml syringe. Most people are like, "What? I don't know. It doesn't even make any sense." So I'm gonna hold on to it because it's not wrong. You can flush. Think of it as an IV. You can flush an IV. So okay, I don't really know why I do it, but let's keep it. It's not wrong. Number 4, use clean gloves to reapply an occlusive dressing to the insertion site. a CVAD procedure is not a clean procedure. It is a sterile procedure. So if you don't know that, write it down. And if you don't know what a CVAD is, I want you to just take 2 minutes and look it up, like a picture of it. So that's why it takes away number 4. So if you put number 4, honestly, if I didn't know if it was a whatever I just said, a sterile procedure, yes, I'm signing on, then I would have picked number 4. But because, remember those little words, use clean gloves, nope, automatically done, because I know that it is not clean, it is sterile. So now number 4 is gone, and number 2 is gone. So now I have number 1 and number 3. So removing an old dressing, do we move, if we were going to take out, let's say, an IV, would we go against the direction of the catheter or toward? So if I'm pulling out an IV, let's say my arm is out and you're standing in front of me looking at my face. I wish you could see me. And I had an IV in. Are you pulling it toward you or toward me to take it out?
Wait, what was the question again?
If you were removing an IV in my arm and you're standing in front of me, are you gonna pull the catheter out towards you or towards me?
Towards you.
Yeah, towards you.
No, think about it. Sorry. I guess I can't show you. Are you ever going to move against the direction something that was inserted?
No.
What's that going to potentially do to the catheter? Break it, right? Or dislodge it? So you have to kind of visualize it. I think once you've seen the picture of it, if you've never seen what it is, but it's really an IV. It's just done in a different way. So you never, ever, ever move against the insertion site. So if you didn't know that, which I know you do know that, please write that down. Never move against the insertion site. So we know that that is not going to be the most important action for the nurse to take, right? To remove the old dressing over the insertion site, moving against the direction of the catheter. Because more than likely, you're going to pull that sucker out or dislodge it, and that is not fun because when you put a CVAD in, you have to like get x-rays and make sure it's in the right place. So I would take a couple minutes and look up CVAD because those are pretty popular on tests. And so really the only one that makes sense, even though it's like, okay, this is weird, is actually number 3. Can we flush IVs? Yeah, why not? It's not saying I need to, but that's the only one that's right because number 1, 2, and 4 are not things that we would do. The only one that is considered okay is number 3. Flush the unused catheter lumens with a 10 ml syringe. So one thing I didn't just say before this, I did not write these questions. Please do not hate the messenger. If you feel, I expect you to feel slightly frustrated after today doing the questions. That's actually very, very, very normal. That's why we do these not 5 or 6 every time. We usually will do 2. But this is why we do them, right? So that we can get really, really good at them because the more that we do, they can only think of so many questions on the test. So if we do 8 on glaucoma and you get a glaucoma question, I'm just saying if you study, and study and study and study, even though you may not get that same question, you know a lot about glaucoma, right? Yeah, because you did so many questions. So if you're feeling a little bit frustrated or kind of like, oh, may not work or it may or this or any of those feelings, I wish Rosa hopefully will attest, and Lupita's not here, but doesn't it start to click? Remember we would do these in post-conference every time? It really does.
Yeah, it does.
And I think it was Rosa that said my medication madness that we'll do. And she actually asked me to do that. So we'll probably do that next Monday. We'll do 2 questions and then I'll start teaching you medication madness, medication that is surrounded around mental health, since that's what your test is going to be on next month. Does that sound good?
Yes.
Okay, I can't see.
Yes.
Sorry, I hate this. Oh, I can. Wow, I can stop sharing. I think. Stop share. I don't know what is happening, to be honest. Like, life is, join share screen. No, I just want to see my people. Well, apparently that's not going to happen, but next week I'm going to see you. I'm going to upload this again. So if you do want to watch it again, you're more than welcome to. And for those that didn't come, can watch it. I'm going to make a note to myself to upload it tomorrow. And if you need anything in the meantime, let me know. Otherwise, please turn in your 2 assignments by 5 o'clock. I think I put 7 on accident. I'm going to check right now just to make sure. But if I did 7, I'll just leave 7. But I will make sure that there is a time link to it. Any questions or concerns or anything anyone needs before we log off?
Are the assignments already posted on Canvas?
Yeah, they are. Yeah, I posted them. So sometimes you will notice, you'll be like, oh my God, are we even having class today? There's no Zoom. Sometimes I do it last minute because I know what I want. I just haven't published it yet because I need to fix a few things. So yeah, everything's there.
Okay.
I had a really bad day. If anybody wants to know, I cried at clinical.
Why?
As an instructor, I don't want to get into it because I'm finally like kind of relaxed over it, and now I have to go to one more meeting, then go back to that job. It's where I've worked for 6 years. This lady was so mean, and I'm not like, I mean, Rosa, you've seen, like, yeah, I'm mushy gushy, but I don't like, I'll cry if like something emotional happens and like, or joyful, but this lady was so mean to me, and then I threw up. So, but you couldn't tell, right? I made it through the class and you couldn't tell?
Nope.
Hey, exactly. And this alone has helped. Just hear, I wish I could see your faces, but just hearing your voices and hoping that this was a little bit of this is the beginning of the beginning.
Miss Meta, I think are you using your phone to do the Zoom?
No.
Oh, okay. Never mind.
Next week it's going to be much, much better because either I'll have a new computer or I will I'm going to show my face and this won't be a problem. I'm not showing my face because I cried all over it, basically. I'm not going to lie to you. And my eyelashes are off and I'm a freaking mess. So
And your lip.
I'm human. All right, my loves. Any questions or concerns before you do your just short assignment? And then we will do medication madness and a couple questions next week. Hello?
Okay.
Yes.
Everyone's good? Okay. All right, let me know if you need anything in the meantime. Text me or call me, okay?
Thank
Sounds
you.
good. Thank you.
Much. Bye.
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 Hi, thank you.
You're welcome. Bye.